The broadcast is now starting. All attendees are in listen-only mode.
Well, good morning, good afternoon, and maybe good evening to some of you. My name is Andrew Stalker, and I'm the head of MetLife's employee benefits business for the Gulf. Let me be the first to welcome you to MetLife Gulf's Thought Leadership webinar series entitled The Impact of the Lockdown on Health. Data showcasing the pandemic's impact on claims performance. MetLife's webinar series, such as this one today, focuses on delivering informative and topical thought leadership that impacts a broader population of the region and our world. Frequent questions that I've been asked over the last 3 to 5 months is, how did COVID-19 and the cautionary measures taken during the lockdown and after impact the health of the community, and how did it impact my claims experience? While the early signs of claims performance impact was immediately realized, it is the underlying claims activity that gives us a more granular view on why and for what members are seeking health care or not. Leveraging our DataWorks platform, MetLife developed in 2019, to improve data outcomes and actions in the market with our customers, we are now able to share some of the key findings of the impact of the lockdown on the health of our members. So without further ado, I will now turn it over to our head of claims at MetLife Gulf, Dr. Shafiq. Doctor, take it away.
Thanks, Andrew. My name is Dr. Shafiq Sheikh, and as Andrew mentioned, I'm heading the claims team in the Gulf region. That not only includes the claims itself, but managing the complete claims, including the prior approvals, fraud-based interviews, and quality assurance itself. So today's interesting topic about what happened to our claims in pandemic, and more so after the pandemic. We have a panel of doctors with us, our partners, and I'm going to introduce Dr. Hisham Hakim first. Dr. Hisham is representing American Spine Center itself. He has completed his studies from USA, and then he in the treatment of non-surgical solutions for either back pain or neck pains itself. And interestingly, he has been part of the task force in USA as well to lower the disability from by 10%, and the target is 2025. So he'll be giving us some good insights of what can be done and how we can continue the behavior of the claims which we have seen itself. Along with him, we have Dr. Asif Sattar. He has completed his pulmonology respiratory medicine from UK. Interestingly, he was the one who has developed the first pulmonology unit in the Dubai Healthcare City. He is associated with King's College Hospital, which is affiliated with a teaching hospital in London, King's Hospital. Along with that, we have another colleague, Dr. Deepika Parihar. She has done her training also in UK, and she's a member of the Royal College of Psychiatrists as well. So these panelists are going to help us in defining what can be done moving forward. So today's interesting topic is not only to talk about what happened during pandemic and post-pandemic onto the claims, but also to learn from it and understand that are there any takeaways for us which we can move forward and see how we can bring in a change into our lives, and also that is going to reflect into our claims itself. So during the pandemic, everyone probably is aware about it, that 50% of the claims went down. Now, this is a high level itself, and there is no rocket science to it. It went down because there was lockdown, there was fear, there was tension, there was a lot of anxiety across. So due to the lockdown, people were not going. There was a mandate from the government itself that only those people who have emergencies can only go and seek the treatment itself, and people themselves were afraid of going and taking the treatment or going even to the doctors as well. So apart from the emergencies, we were not seeing anything going to the doctors, and this is where we saw a complete drop, 50% in the claims for a month or two. However, once the lockdown was over, what did we saw? So to understand that, what is happening pre-lockdown and what is happening post-lockdown, we started doing some studies onto our claims data itself. And what we saw from the claims data was something very interesting. And that interesting thing was that we see a drop in the claims of respiratory conditions. Now, this is the first thing, and we will also showcase what other things we have seen from the data. But to walk you through that, when we saw that the claims of the respiratory conditions went down, we wanted to understand better into it. And this is where we divided this data into age brackets, into different age brackets. The most interesting dip which we saw was that there is still an 85% drop in respiratory condition claims coming from 0 to 10 years. Now, why did this happen? That's a question which was coming up. And I think the answer to that is very simple. There is a change in the environment itself, where the children are not going to the schools. Even those who are going to the school itself, parents are very conscious of the fact that they are teaching them the good habits. So they are teaching them to ensure that the mask is on, they're teaching them to keep on cleaning their hands regularly itself, and to ensure that all the healthy habits are being taken care of. So these common respiratory conditions, which we generally are known as upper or lower respiratory conditions, common cold, cough, flu, to some extent, bronchitis and asthma as well. It's a very vast majority of things which fall under the respiratory conditions. All of these, which attributes to the respiratory claims, started to get down. Similarly, along with these, we have also seen some decrease in the utilization of antibiotic, which used to have for these respiratory conditions. Now, the second set of age, where we still see a good drop of the claims close to 70%, were from the ages of 30 to 40 years. We have also seen a drop in the other age categories, but these were the two main category of ages where we have seen that the cases have really gone down. These 30 to 40 years of old cases, why we have seen it down? One, probably these are the parents who have taken care of themselves along with their children to ensure that they remain healthy as well. And due to the COVID, they want to make sure that they take all of those healthy habits, whether these are washing hands, avoiding the touching of the face, cover up yourself when you are coughing or sneezing, cleaning the surface, avoiding the crowds itself. So probably these are the things which we saw has brought in a change into the claims of respiratory conditions itself. Now, these behavioral impacts generally spreads the disease. This went down because of all the good habits, and the parents were continuously teaching their children that these are the things which are going to avoid the spreading of the germs. And by doing all of these good things, we not only saw that there is a decrease said that, I'm going to invite Dr. Sattar to share his thoughts and what he has seen a change post-COVID, and does it correlate with the data what we have seen in our claims.
Good afternoon. I hope you can hear me.
Yes.
I agree with everything Dr. Shafiq has just talked about, and initially to see that 70% of my patients between the 30 and 40-year bracket would have come down as much as you told us. I think there's a little bit of a difference in my practice because a lot of these infections, bronchitis, viral infections, would probably go to the general physician, and I think the biggest drop of these patients seen in their practice. As a pulmonologist, obviously, we do see infections, but we see the more severe type of infections that come either through the emergency and we see other conditions related to asthma and sleep and lung cancer. So I agree that all of these things that the general public have been doing to avoid COVID has obviously helped them prevent getting other viral infections. So it's just that maybe in a purely pulmonary practice, we do not see such a huge drop simply because we don't see that spectrum of patients who would likely go and see a general physician or internal medicine doctor. But I agree. I mean, all of these changes that have been done and people are being more proactive, they're being, they're sanitizing and using masks and the children are not at home. These infections are obviously have dropped significantly, but still, I'm surprised with this 75% or 70% number in this age. The rest, I mean, in terms of pediatrics, speaking to my colleagues, I think it's also very clear that drop has been more dramatic because the kids are all either at home or regards to online schooling, or they are taking all the precautions and the parent all your statements. But I'm a little surprised to see that the number is the percentage is so high.
Thank you, Dr. Sattar. And during the course, when we open up for the Q&A, I'm confident that looking at these interesting statistics, there will be some questions related to that. So I'm going to, with these comments, I'm going to move on to the next one. And that's another very interesting thing which we have seen in the games, and that is related to musculoskeletal diseases. Now, in terms of musculoskeletal diseases, this is another area where we have seen the cases going down itself. Now, we wanted to investigate to identify which are the major areas where these musculoskeletal conditions really have an impact. Generally, if you look into the musculoskeletal conditions, on a high level, these fall into lumbago, typically called as low back pain. We call it cervicalgia, typically a neck pain, knee pains, generalized pains, or shoulder pains. Now, I'm going to pick up two basic ones, which are very, very common, and that's related to a lumbago and a neck pain. So when we talk about lumbago, mainly it's pain which is in the area of the lower back itself. It can be an acute pain, it can be chronic as well. There is a discomfort and a pain in that area, and studies always suggest that in 25% of the cases, a cause can be found, whereas in the rest of the cases, it's very difficult to find a cause. Main risk factors generally are related to obesity, prolonged sitting, occupations, and definitely age as well. But excluding the age thing, the question comes is that can we prevent it? And as we hear that the risk factors are related to obesity, prolonged sitting, and not performing exercises, and not performing or not having the good postures itself, the answer is yes, that all of these are very much preventable. And instead of keeping on treating with the painkillers, muscle relaxant, and other things, it is far better if we stay active. So one of the things which we were trying to understand that what does COVID have to do with the musculoskeletal conditions and why COVID has brought this down. Very interestingly, we understand that when people used to go to the office, there was long sitting hours in the cars, within the offices, the postures or long sitting times, and people were not moving around to do simple exercises during the day. And definitely the lifestyle totally changes when you go to the offices, and unhealthy living habits, unhealthy eating habits, not going for exercises itself had an impact. So that impact is not only on the back pain itself, we also see a decrease in the neck pain as well. The risk factors pretty much are the same, which are related to occupation, smoking itself also exacerbated, not exercising also exacerbate these conditions. When we see these behavioral impacts onto the health itself, we see that people during COVID did learn that one important thing they have to do is they have to enhance their immunity. Now, how did they enhance their immunity? One thing which everyone started doing is that everyone started to hear that let's take vitamins, whether it's a vitamin C, whether it's a vitamin D, different kind of vitamins to ensure that my immunity is on a higher level. And at the same time, people started eating healthier and they became very conscious of exercises. So a lot of change has been seen in this area where people regularly do exercises, keep themselves fit, keep on moving all together, so that this has brought the change where we have seen a decrease in the number of cases related to back pain. And so this simply is telling us that if we continue to do exercise, if we continue to do the right things for our health, we are going to see a change into these cases. And we have Dr. Hakim here with us, and he has been a big promoter of having these healthy habits. And I'm not going to steal anything out of what he wants to say, and I'm going to give him a chance because he has been a strong contender by saying that, listen, your neck pains and your back pains don't require a surgery. There are a lot of things and a lot of change you can bring into your body with a little change in your habits itself. So I'm going to pass it to Dr. Hakim for his comments. Dr. Hakim? All right. So I think Dr. Hisham is having a challenge in probably his audio. I have been a patient with Dr. Hisham himself. Once I had a back pain and I went to him. So I can share some of the things what Dr. Hisham generally teaches all his patients. So Dr. Hisham will tell you that changes in your lifestyle is going to give you probably 100-year scenario where you can live happily without these pains. And
Dr. Shafiq, can you hear me now? Dr. Shafiq, can you hear me now?
I can hear you, Dr. Hisham. Welcome. Please continue.
Yeah. Yes, sorry. Thank you, Dr. Shafiq. Actually, I'm in Damascus now. So we have a little bit of duty, routing Damascus. But again, thank you, Dr. Shafiq, for inviting us. Definitely, American Spine Center value our partnership with MetLife in treating back pain non-surgically and prevent the need for surgical intervention. Certainly, during the lockdown and during COVID, a lot of things happened, a lot of behavioral things changed of people lifestyle, as Dr. Shafiq said. One thing that the general public had high alert for medical advice during that period. And they had the time to listen to it, and there was a flood of information to the public regarding working in general, preventing COVID, doing certain things to cope up with the lockdown. And certainly a lot of program and videos has been sent to the public about daily routine, daily exercise that you need to do during your staying at home, working from home in very uncomfortable position. And, most people really follow that up. And, actually American Spine Center sent a lot of information regarding that. We did a lot of chatting, video talking to our patient, telemedicine. So there was, again, we are one of the group who really impacted the healthcare system in Dubai and worldwide for that matter. So that one thing that the people have very high alert to the well-being, and everybody felt they are personally targeted. There was really nobody immune, including the healthcare staff, doctors and nurses and everybody. So that give us a very alert ear. People start listening to that. One thing that's very important, those daily exercise, you can do exercise every 1 hour, just 2 minutes, or every 2 hours for 2-3 minutes, just stretching really by itself help get your back, neck joint really much better. Number two, there was a lot of issue regard of enhance your immune system. We did find that most victims that had the COVID and who really had the serious cases them down, and they found out vitamin D particularly was very, very crucial in helping the immune system. And that by itself not only decreases the immune system, but also has a lot to do with your pain, musculoskeletal problem, your back, your disc, your joint, your collagen element in well-being of those part of your body. So the people start taking an appropriate vitamin D supplement that really help their musculoskeletal to improve tremendously. Matter of fact, when we have somebody have acute disc condition, one thing we always target to maximize their vitamin D. And one of those important elements really help in improving and recovering this pathology for that matter. So that one thing that really become very much on the surface of everybody. Everyone starts asking for vitamin D supplement. And then again with it, they start taking multi-other vitamins, vitamin C, zinc, selenium, which all are supporting your system, musculoskeletal, immune system, pulmonary system. So that really improve your well-being. The other big factor that we found out too, smoking was very detrimental for the immune system. It was a very high risk factor for a musculoskeletal problem, because we find out most people who are smoker really, mostly at high risk for severe cases or even dying. Factors was vitamin D. So these two big factors was there, and people start understanding that's really a big risk factor for their catching COVID, and they start cutting down. And as we know, all shisha and all that cafe has been also closed, so that definitely helped a lot. Third thing is we did find that people having good night's sleep. Sleep is crucial for general well-being and particularly musculoskeletal. Patients start staying at home, taking naps, sleeping early, waking up early, exercising. So that little bit of a lifestyle changes had positively impact the general well-being of people, and definitely cut down on all those musculoskeletal conditions. So basically, those lifestyle changes that people start using, become high alert to that, that start listening to the doctor, listening to the videos. A lot of education came in from this COVID. I mean, general patients are talking about immune system in detail, and that's really very nice to have such an high educational course for us in the last several months. Another important thing is really find out we had our really acute cases used to come from sport injury, especially in the gym or bike, heavy lifting of weight. So that's easily subsided because of the gym closed and there's no much high risk sport. And that's another element for those acute cases. A lot of our cases come from young people who go to the gym, overdo it with or without coach. Sometimes the coach pushes the person and really get them overweight or overload their back. That's another important thing that had helped. Now, one thing also, people stress level has improved initially, but later on really tremendously increased because of the lockdown. And that then starts flipping the circle over the stress that really kind of magnify your diseases and magnify your problem. And again, I know we have Dr. Deepika can talk about that. So I'll let you that part for her. Now, one thing was really negative in terms of working home. A lot of people start working their kitchen table, their couch, on the bed, and that's how they spend several hours working. And that's definitely very, very poor posture. And again, that was a little bit affecting them, especially when working from home become really serious. Initially it was like working on and off. Then after that, people start working like 8 hours continuously on a kitchen chair, and sometimes they don't have working hours. I said I'm working 18 hours because it's nonstop to us. So that was really impacted them later, and I think now it's a little bit more regulated. The working hours, especially in the teacher category. So those particularly small things really that have helped in impacting the well-being of the patient, understanding the problem, understanding deficiency, understanding well-being, the impact of good night's sleep, exercising, good health eating. Stop bad habits such as smoking, of course, alcohol as well as a big impact for that. All those collectively, that has helped. One problem I can mention, most people complain from gaining weight, staying at home and eating a lot. So that was a little bit of a problematic for some patient, over time. So that's basically, the pros and cons, but that what the positive much way outweigh the negative in the outcome of the musculoskeletal condition. Now, one little bit caveat here. For now, people start going to work, and at home, sometime at the job, and shifting. And I felt that most people like that. I work 1 week from home, I get all my resting and what I need to from home. Then I can go at work, and I have my life, social life, friend life. Really. So that balanced out the stress and impact and psychological problem. So I don't know our audience. I know all of them are in big companies. So if you like to get your staff to have high production, it's really shifted them 1 week on, 1 week off. It's very effective way. But the way this is summary of what we have noticed during our lockdown period, and really it was have very positive impact on our patient. Any question, I'm available for that.
Thanks, Dr. Hisham. This was very insightful and very interesting as well. Now, up till now, we have seen, just showcase 2 areas where we have seen the claims going down. Now, there are a lot of areas where the claims went up overall as well. However, there is one very interesting area where we have definitely seen cases going up. And that area, to some extent, Dr. Hisham has mentioned about that as well. That's related to mental health. So we saw that mental health cases have gone up by 100% or even more. I'm going to ask Andrew to give his insights on the mental health issues. Andrew, over to you.
Great. Thank you, Dr. Shafiq. I appreciate the opportunity to speak about mental health. And I think it's widely recognized globally that COVID-19 and the impact it had, both from an anxiety perspective and a depression perspective, both with respect to being isolated and not being able to see loved ones, feeling alone, and then in addition to that, the concerns one had or people have about the virus itself, their work, and the health of their family and loved ones, has had a significant impact on the mental health of the human race. I say it as broadly as that. And certainly here locally, we can turn to the work that MetLife did between the months of March and June, where we opened up a mental health crisis hotline for a large population of our covered members. And from that, we produced a white paper, and that white paper highlighted the not only utilization and for reasons why members utilized the hotline and the services, but it also gave us a glimpse into the demographics surrounding those that were using the hotline and struggling with mental health challenges. That white paper has been published on LinkedIn from the MetLife Gulf site, as well as from a number of MetLife associates, and can be shared with anybody who has interest in reading it. We also, of course, saw in our claims statistics, as you mentioned, Dr. Shafiq, an increase in the need and desire to visit with a clinical psychologist for mental health related challenges. And again, these were tied back to most significantly the two major drivers, those being anxiety and depression. So from two aspects, the data tells us that this is real, and it doesn't take but a quick Google search on the topic to realize that this is in itself a significant issue for the human population. It was before, it will remain, and it will be in the future. And one of the questions that was asked, and I just want to answer this related to mental health, I'll come back to it during the Q&A from the audience, was what is MetLife doing to address in its plan designs and its services changes to support the changing behavior concerns of its population. And in this particular area, we're doing two things. We've made our employee assistance programs more widely accessible to our customer base. And two, we are expanding our psychiatric network and making our psychiatric network on a direct reimbursement network. That will be coming later in the start of the year. Well, I should say, hopefully by end of Q1. So some really important enhancements that we feel our customers have told us, and we also feel from the data, is an important move in the direction of supporting our customers and members. So with that, I'll turn it back over to you, Dr. Shafiq. Thank you.
Thanks, Andrew. I'm going to take this opportunity to ask Dr. Deepika, what have you experienced post-COVID in terms of the mental health issues? All right, so I think Dr. Deepika is having some challenges in her audio and
Hello?
Hello, yes, Dr. Deepika.
Hello? Hi,
Yeah.
can you hear me, Dr. Shafiq?
Yes, we can hear you, Dr. Deepika. Please continue.
Great. Hi, hello everyone, and I think it's quite an interesting presentation and alarming stats, to kind of know that what has been happening, during the pandemic and post. during the pandemic and post lockdown. And I'm quite surprised to see the stats that the mental health issues in I've seen a huge jump, in my clinic with patients presenting with anxiety and depression. You're making in the claims, because many of the patients, even though they're suffering from mental health issues, would not come to see a psychiatrist because their insurances don't cover mental health, and that is a sad part of it. So what I have been noticing in the last few months since the start of the lockdown and the pandemic is the increased cases of anxiety and depression across all age groups. My majority of my client age involve adult population, but I think I've seen a lot of children in the last few months, and that is worrying. The reasons being children being stuck at home doing online classes, parents working from home, having difficulty managing home and children. And because of that, there's increased cases of social isolation. People are not able to go back and see their loved ones, not being able to see family and friends. And that have increased social isolation and have led to this tsunami of social recession. I think what people initially recognize is as having an impact on the economics and the finances of people losing their jobs. But I think what we did not realize until the last few months is what this pandemic has caused, something which we have termed as social recession. And I think for months to come, even after the pandemic is over, it would have huge implications on mental health. So when it all started, the people had fear of getting the virus. People had this fear that if they get the virus, they might spread it to the family. People who got the virus, who were placed in isolation and quarantine, and I was involved seeing all these COVID patients, and the kind of the fear they had is difficult to explain. And once they were out of the quarantine, still they had this stigma that people would not see them or meet them because people still had fear that they might still be infected. People lost jobs. People moved homes. So this was like a huge tsunami of mental health issues which I've seen for the last few months. A lot of marital problems came up, to a surprise, because couples were at home, the parents were at home. There was lots of domestic issues. I've never seen a lot of marital problems, before the pandemic, which I saw during the lockdown period in the last few months. So I think what I would want to emphasize, that what I've noticed a difference in my practice during the lockdown and during the pandemic is a huge rise in cases in children in terms of behavioral issues, anxiety, depression, and self-harm. And increased anxiety and depression, as we all of us are aware, and the marital issues and the domestic violence. And on top of that, as I mentioned before, the social recession which we all are facing and probably would be facing in many more months to come. So I would completely agree with what Andrew spoke about and Dr. Shafiq, and quite surprised to see the figures. I think I would just completely agree, and I think I'm quite happy to know that the kind of changes you're making into the insurances, because I think there's many people would be needing mental health services, across in UAE.
Thank you, Dr. Deepika. Thanks a lot. Now, with this, we are going to open up our Q&A session, and we encourage everyone to ask questions. Meanwhile, we have already received a couple of questions, and I'm going to direct it to the panelist itself. Dr. Sattar, one of the questions have come up is that what can we do more to protect our kids? Is overcautious behavior good for them? Should we continue to do what we have been doing, or is there a different way to live as a family? Now, sort of a generalized question, I understand, but at the same time, it's more inclined to understand that how can we prevent the kids from these respiratory conditions? So your thoughts, Dr. Sattar.
Thank you for the question, Dr. Shafiq. Yeah. I think to prevent the infections, I think we're doing everything that we can do at the moment. I don't see us increasing in any way. I think the children, in terms of their protection, they're using masks. They're at home, or they're going to school and they're doing online, and they're socially distancing themselves. The issue, I think, will come up once we are able to confirm on how the vaccination of or what I would call the post-COVID, after the vaccination comes through, what's going to happen. And I think I think the masks will never go away, and I think we will continue using them. But I guess once the schools start and children start intermingling, and then we will be getting these infections back. They will be getting the infections back home. We will definitely see an increase in the usual infections that we see with the infections. And the other thing, obviously, that we need to understand is, other than infections, obviously, we need to be aware that there's a lot of patients or clients in the community who have been coming to clinics or hospitals for help with other symptoms. I really think these are COVID symptoms and that they would prolong it. And I was just reading a Cancer Research UK article today about, almost 50% patients who have lung cancer have actually not taking any sort of advice or coming to the doctors, because the symptoms would be quite similar to any other respiratory infection that just started. So I think we need to be aware of these issues, that probably there will be another tsunami of patients coming into the respiratory clinics with non-infective issues, which they have been neglecting for some time. And I can see that one of them certainly will be lung cancers. I think oncology will be an issue which will increase dramatically, because people have been holding back on a lot of their symptoms and getting help. Almost certainly there will be a lot of sleep issues, which we're seeing now, and a lot of patients who come to respiratory are being redirected to the psychiatrist because a lot of symptoms are related to anxiety. But from a point of view of infection control, I think once things change to the vaccination, people will generally get more complacent and put their guard down. And I think we will see more patients come through with the usual infections.
Post-COVID, please ensure to continue these healthy habits, which is the only way you can prevent these conditions. They're preventable. However, the other side of it is that there are cases who are holding back, and we also expect a surge into that. Now, with this, Andrew, a couple of interesting questions have come up for you, and I'm going to club these two. So one of the questions have come up that MetLife as an insurer, are you evolving the benefits to the members based on the new data or cases which arose during the lockdown? And what is MetLife doing then to sustain the health during the lockdown or post-lockdown? So your thoughts, Andrew, on this.
Great, thank you. I received a follow-up question about psychiatric treatment as well, so I think there's some great interest there. So I'm going to try and answer it with some direct certainty, and then also pause for reflection. The first thing that is there's a difference in where and how members want to seek treatment, right? And so there's some core changes we need to enhance and evolve in the system. And one of those we mentioned was the development of a direct reimbursement for psychiatric treatment. So if a plan, a customer, an employer, or a member has the benefits in their table of benefits, in their coverage, then we hope that by the end of the first quarter, they will have a panel of providers that will be part of an in-network benefit, and they'll be able to receive more available care on direct reimbursement basis. So that's the first comment I would make related to actual specific changes we're going to make in how we deliver care. The second is we're going to try to work to make care more available everywhere. And what I mean by that is, of course, first, the evolution in telehealth and telemedicine is going to be a core focus of ours, as it always has been, but we're going to continue to evolve our capabilities for our members as we head into 2021. One of those examples is we're going to begin piloting healthcare anywhere, which brings the ability to have healthcare, aspects of healthcare provided to you at home. We think this is important not only during a time when families are isolating at home, but we think also the mentality of the consumer has changed as well, and this will be welcome as an opportunity to evolve care. Then I think I'll answer the question more sort of towards the future. And I think it's going to take a few more months for us to realize whether what we saw in the first few months of activity during the lockdown and post-lockdown is can keep people healthy. And I think there's a lot of stuff we already do today, but I think what we're learning from the pandemic is that there's always opportunities for us to continue doing it. The last comment I'll quickly make is that, and I think Anwar is going to share the link in the chat box, I hope, is that there's many, many resources MetLife makes available to its employers. And Nancy Murad, who runs our disease prevention and health and wellness team, makes available both digital assets to our employer, either through the web or through many of our health talk shows, and also does on site, when we return there. But there's many resources, starting with what you can avail through MetLife Online, and then what you can avail through some direct conversations with our customer-facing team. So encourage those that are interested to reach out to the MetLife group. Thank you.
Thanks, Andrew. So, Dr. Hisham, an interesting question has come up, and I know that we are getting a bit short of time, and you have covered a lot of this during your conversation. But somebody has asked an interesting question that, how long can you take these vitamins for? Isn't it bad for your liver? And I'll add up another question which has come up saying that, what are the best vitamins to avoid these kind of problems? I know that you have mentioned it during your conversation. And similarly, they're asking, is it healthy to give vitamins to the kids? So would you be kind enough to quickly cover this one for us?
Do you hear me now? Do you hear me?
Yes, Dr. Hisham, continue.
Okay. Yes. Yes, vitamin D. It's a crucial for. It's really vitamin D is very underrated. The importance and the value of vitamin D. I invite everybody to read about the vitamin D importance, not only for the bone and joint, but really it interferes with a lot of activity, with the mental well-being, with the health, with the attitude, with the fatigue, with the clarity of thinking, as well as all other musculoskeletal we know about. So it's really considered sometimes a hormone more than a vitamin. Now, what is the adequate dose? Really, my goal always to keep my patient at the highest level of the range of the lab. Usually, in Dubai, usually the rate between 30 and 80. I like it to be 60 and 70. To me, 30, even 40 is a little bit low. You need to have a high performance rather than a low performance. So that's really very important. So the answer to the question is simple. Check your vitamin D. If it is really low rate, you have to take therapeutic dose. If it's below 30, you see sometimes 10, 20. Then you have to therapeutic dose. I recommend strongly vitamin. Then what's come to be around 60 or 70, the level, do not stop the vitamin D. You need to take a maintenance dose to keep that level, i.e. you can take, for example, 20,000 per week and recheck it again in 3 months. If that's your maintenance dose. If it's dropped, you need to increase it to 30,000 per week. So that's the same as for the children. The same methodology will accept adjusted dose, one for injection and also for the oral tablet. So basically, your guideline is your lab results. One other thing I always find challenging, and I may present this to Dr. Fick, I see a lot of resistance from insurance company to cover vitamin D level. And it's really very puzzling. It's really so crucial. To be checked twice a year is really wonderful, approach to improve well-being. Now, as far as other vitamins, I always believe if vitamin D is low and your B12 is low, the chances that most of your vitamin is on the low level or below the level. And we don't test them. We don't test all vitamins. So I do strongly recommend that we do recommend to give the B complex, which is in form of neurobium, which have B6, B1, and B12, and those are also important for the neurospine in general, and take it in oral and or in injectable form. And I recommend strong quality multivitamins. A lot of multivitamins on the market are really cheap. They have no values. I recommend to take high in quality, multivitamins along with all those things. And I believe you'll see so much tremendous difference when your performance, when you're at the high peak of your vitamins, and especially if you have back pain, and especially if you have joint pain, this almost will be eliminated quickly with that. Another quick, cheap vitamins and that daily exercise that, Dr. Shafiq, I always preach it. And you have to do it really simple exercise, 10 minutes a day for life, every single day for life. Those are simple things, plus good night's sleep, plus good posture, to me is a formula for well-being and health. So those, simply is the recommendation.
Thank you very much, Dr. Hisham. I'm quickly going to ask the last question, although we have others, but I've chosen this one for Dr. Deepika. And again, it's a bit of a generalized, but more inclined towards the mental health. Will COVID-19 change the course of medicine in general, and will we become weaker, both mentally and physically? So I know it's sort of a generalized question, but it has a mental element into it. So what's your thoughts, Dr. Deepika, on it? Okay, so probably Dr. Deepika is having some challenges on her audio.
Hello?
I will.
Hello?
Yeah, please continue.
Dr. Shafiq, can you repeat the question, please? Sorry, I was not able to hear, so there was some problem with the audio.
No, the question is a bit generalized that people are asking that will COVID-19 change the course of medicine in general, and will we become a weaker race mentally and or physically as well?
See, it would definitely change the way how the physicians have been practicing medicine in all those years. Because I think Dr. Asif and Dr. Hisham would agree with me. Mental health comes quite in bottom of the list for all of the physicians. What generally happens is that once a patient presents to a physician, we would kind of eliminate any physical reasons for the symptoms. And in the end, you would consider, a psychiatric reason for the patient's presentation. What I have noticed in these last few months of the pandemic is that there's a lot of my colleagues and a lot of my, physician colleagues have referred me patients. As Dr. Sattar would agree, he had referred me a lot of patients presenting with sleep problems. A lot of patients with, with my family medicine colleague presenting with headaches, somatic complaints. And these are the symptoms of anxiety and depression that would, before the pandemic, the physicians would not acknowledge is as people having mental health issues. But now, because of the pandemic, at least people have become aware of the mental health issues. The general public have become more aware. And I think people have become more accepting. Initially, there used to be a lot of denial of mental health issues. People in general, the physicians in general, have become more accepting and have become more aware of the psychiatric presentation which the people present with in the clinics. So I think it would change the physicians and the perception and the people's perception of how we used to think about mental health in the past. So I think it would generally it would change the whole thought process of not only the physicians, I think people in general, and that is the most important thing, that people are aware of that mental health is also quite an important aspect of your day-to-day functioning. So yeah, I completely agree.
Yeah, Dr. Shaf, let me add to Dr. Deepika's point, because I agree with that, and unfortunately, it's very underrated in the medical practices. And if the patient doesn't go to psychiatric clinic, they don't address the psychiatric problem. In my book, everybody who has chronic illness of any kind in my field, like musculoskeletal, they have an element of underlying stress and depression. If you do not treat that early on, your outcome is become less favorable. And we at MetLife's Center, we see a lot of complex cases who have back pain, discrimination, pain for like 6 months and needed a surgery, very complex cases. I always push for give them something antidepressant, just to let them float a little bit and maybe see the light, if you wish, because they are so much. That's what Dr. Deepika said.
I completely.
And that's really important.
Yeah, I completely agree, and I'm very pleased to know it that you think that way, because I think there's a lot of reluctance from the physicians to refer patients to a psychiatrist. And if at all they tell the patient to go and see a psychiatrist, then even the patients are more reluctant to go. So I think it's both way, but at least I've seen a dramatic change during the pandemic, that people come and see me and say, oh, do you think, doctor, this is normal? I've been feeling like that. Is this common? So So I think I've seen a lot of change in the last few months, and I think it's good to see that people are at least becoming aware of mental health issues. Yeah,
that's very true. That's very true, and that's the problem we are seeing currently.
Yeah.
You know, we have to treat them, you know, comprehensively, 360 degrees to get good outcome. And I'm definitely on the same page with Dr. Deepika and Mr. Andrew.
Yeah.
Great. Thanks a lot for all of these insights. It's really very, very interesting. I know that we're a bit getting short of time. So I'm going to request Andrew for any of the last comments.
Well, listen, first of all, thank you all for a truly informative presentation. I'd like to also thank each and every one of you, members and the entire industry of healthcare professionals for what you've done for the community and continue to do the community in the world as frontliners. So thank you again on behalf of the MetLife team, and I'm sure all of the guests that are attending. I'd like to thank everybody who's joined and stayed with us through this hour. I hope you found it informative. Please stay safe, take care of yourselves, and take care of others. Thank you so much.
Thank you.
Thank you very much, everybody. Thank you, Dr. Shafiq.
Thank you.
Thank you, Krishna.